Hi there. My name is Sarah Drummond. It's lovely to be here at Design in a Fluid World. When I say be here, be in the new present of the virtual world, but also possibly coming to you by video. So I am immensely sorry, and maybe the organisers explained today, but I was going to do this talk completely live. I'm actually doing it 4 hours in the future than when I was going to do it. Yes, I have that talent of being able to present myself into the future. But there's been quite a lot of quite stressful situations in the UK today around making sure people can get to the place they need to be around Christmas. So I'm actually on the move. So hopefully I will be coming to the live Q&A and actually giving this talk live to you. If not, you're stuck with the video me, but I have actually just done this talk 4 hours before it's going to be played to you. So I hopefully it feels as live as it can be. So today I'm going to talk to you a bit about the uncomfortable world of designing intention, as designers do, under tense situations. I'm going to ladder that up towards the end because I want to talk to you about designing complex services, designing in complex systems, and then the tension that comes with that. I'm going to start with a short clip today from a film called I, Daniel Blake.
I see you've only scored 12 points and you need 50 to obtain benefit.
Oh, points, that's your game.
I'm sorry, sir, but according to our healthcare professional, you've been deemed fit for work.
So Sheen has got my doctor, consultant surgeon, and a physio team. Well, I want to appeal.
Well, that's fine, but you'll have to first request a mandatory reconsideration.
What the bloody hell does that mean?
It means the decision maker will reconsider it. If he comes to the same decision, you can then appeal.
Right, we'll put us down for that then.
Okay, sir, but you must wait to get a call from the decision maker.
Why?
To tell you what the decision is.
But that's already been decided.
On the one hand, job seekers allowance only for those able and ready to work. But if you're ill, you have to apply for employment and support, get an assessment carried out.
Well, I've done that, but they've knocked us back.
Right, well, if you've been deemed fit for work, your only option is job seekers allowance, or proceed with the appeal on employment and support.
Right, can you give me a form for, job seekers allowance and then an appeal form for employment and support?
You have to apply online, sir.
How can I do that?
Well, that's how it is, sir. Or you can phone the helpline.
Listen, you give me a plot of land, I can build your house, but I've never been anywhere near a computer.
Do you know what? We're digital by default.
Oh, here we go. I hear this all the time on the phone. I'm digital by default. Well, I'm pencil by default. Look, I mean, what happens if you just can't do it?
There's a special number if you've been diagnosed as dyslexic.
Right, well, can you give us that? Because with computers, I'm dyslexic.
You'll find it online, sir. I must ask you to leave now, if you've got no appointment.
I, Daniel Blake was made, I think, around 2016-17 by a phenomenal British director called Ken Loach. He creates kind of fictional stories based on factual depictions of society at the time. Follows the story of a man called Daniel Blake who cannot work for health reasons, used to be a labourer, and is now stuck in the benefit system trying to find his way. I won't give the ending away, but I do implore you to watch if you get an opportunity. But it shows a kind of unconsciously designed complex, broken and hard to use services and systems that we often put citizens and our populations into. I think what's really challenging for a lot of people to get their head around is that, there's not one person that woke up in the morning and thought, I'm going to design a terrible, service or social care system. But we see this across lots of different sectors. This is just one quote of hundreds in a piece of writing that was done by the British Association of Social Workers, essentially doing ethnography on themselves. And if you were to take a word cloud of all of the kind of words within it, you'd find that most people were complaining about systems, technology, IT, and really actually wanting to quit their work of providing vital frontline services because of the systems that's being designed around them that just don't work or help them to do their jobs. And what we need to kind of recognize when we're thinking about designing better services, better systems, is that every organization and system is a collection of micro design decisions that are made on a daily basis that form our user experience. So when I talk about conscious design, it's the act of, designing with intent, right? Designing with intent to change a behavior, to help a user reach an outcome, to perhaps challenge the way that society runs something. And a really simple, and the product designer in me loves, is the grey boxes here that go alongside the bullet train in Japan. This is a picture I took in Kyoto station, where the grey actually indicates where people should stand for the doors to line up, and people queue up here. It's a form of conscious design because we're trying to create form that indicates for something to use something in a certain way. But unconscious design is when things get made and we haven't really tested it or thought about what the impact might be on the user. This is my stepfather's buzzer system to get into his flat. I have been spending the last 12 years, I reckon, pressing number 11 when it should have been 8. But it also shows the ability for people to actually, challenge and hack and improve things by getting quite pissed off with the numbering system. But I think, trivialness aside, unconscious design really costs us people, particularly at a systemic level. We've created systems that don't solve problems. In fact, they create more work, they cost us more to run, and they take us away from the front line. I think what's really interesting is that we often see this rhetoric or narrative of, design will save us. Having lots of designers will be great. If we make a designful organization, it will be amazing. You can have the best design ops, the best tools, the best designers, the most of them, the most funding in the world, but the user experience can still be terrible for the people that use it. And this little picture that you see behind the text there is of Daniel Blake actually trying to access some of the forms that he was asked to go and look at for his benefits online. And I went to see this film actually in the cinema with some of the people who are behind the design system and the designs that created this website. It's not design's problem here. It's not the website's problem. It's actually very accessible, very well designed. The content is clear. It has been tested with the population. It's the wider system around it that's the problem. So having lots of designers doesn't normally, equal more user-centered, organizations or good services. I think what we have to recognize as designers in a design industry and those of us working across systems is that we all have the ability to make conscious design decisions that aid users. If our systems are to work, we have to learn how to consciously design together and recognize that in some way, we all design. And services and systems are made up of thousands of design decisions before we even get to the point of designing the user experience. So I refer to this a lot as full stack service design. When we're at Snook, we talk to our clients a lot about this, where we're often from a service design perspective or a design perspective brought in to look at what I call, above the waterline, which is the service. So just really looking at that user experience element. And sometimes we get a little bit involved in the infrastructure and looking at sort of background systems. But what we really need to think about is that we need to design in a full stack way, and everything that's below the waterline needs to be addressed, from the infrastructure to the organization and system to the intent. And that covers all these elements like the systems and technology we use, how we measure the service and what we agree, the KPIs to be around how it performs. What does good mean? What's the business model? How does that define the service that we're using? So all of these components are materials of a service and systems as well. And we need to be designing in a way where we consider kind of full stack perspective on that. And just to open that up a little bit for you, I just wanted to talk really briefly about one project and one element of the stack around policy. So this is a backstage kind of background warehouse picture from a major supermarket brand that we worked with, looking at improving their returns process. Now, we did everything that I guess you would be doing if you're kind of looking at a service. What's the user journey of how people, return things, what happens on the receipts when they get it, this clothing that they get from the store. What do they find on the website when they Google, how do I return, this item of clothing to the supermarket? And we started to improve that incrementally, and it had like tiny little benefits. But actually, it was a policy problem. So the thing that had the biggest impact on people actually returning clothes, which is what we wanted them to do, A, it's more sustainable, B, the KPI for the stores to get more people back, is to change the policy to make it 30 days to return rather than 14. And people said they were more likely to make a return. And when we tested this, we found that to be true. So actually, by designing with the policy, we were able to change the outcomes of the service. And that's kind of one way of looking into the full stack. You can kind of go deeper into this at a more kind of societal government level. It's been really fantastic to watch the Scottish Government take on the new social security benefit system. It's a new form of benefits that the Scottish Government has the devolved rights to administer to the public. So we're actually kind of starting from, I guess, a greenfield perspective. And we've been looking at lots of different disabilities like disability assistance. And the policy is what tends to help drive what the service might look like. Now, if you start to go and delve into the policy that's been created, it does start to give you a flavor of things around what that service might need to be, like, you know, having examples of supporting information which might include these things, or talking about reducing face-to-face assessments. So that infers that we'll be looking much more at kind of digital forms of assessment. This policy, I've got to give it up to the teams. I know some of the team working on this has been incredibly well designed, because it leaves enough freedom for them, for the designers and researchers, to actually kind of create the service in the right way by testing it with people. But it's still a policy that is starting to drive, I guess, a certain design brief. So decisions are being made way up the chain before it gets to a group of designers who are actually going to be tasked with creating the website or the forms or the buildings that people might go into. You see a lot in other policies, actually, that you can get right down to the type of paper stock that people should be using, which is crazy, but defines design decisions kind of at a much wider level. And we can look at things like business models. As I said, you know, the intent is quite an important thing to look at when you look at why a service exists. Blockbuster is a UK, well, it's not UK, sorry, it's global actually, but we had it a lot in the UK. I remember it when I was growing up to go and get video cassettes from, if you remember those. And one of the reasons that their business model worked so well is that they actually collected 16% of their whole annual revenue from late fees. So when a lot of people talk about the kind of like old adage of Netflix took over Blockbuster and all the high street video chains, actually one of the reasons that they didn't want to change and take things online and on-demand video was to retain, you know, the fact that people couldn't really be bothered to go out on a cold and wet day and take a video cassette back. So the business model was driving the service design there. You can look at other kind of areas of kind of how organizations are designed, the skills that they have in place, the power structures and authority that exists. And one of the really great examples that I love is Bertskorg, which is a model of home care that was pioneered in the Netherlands. And they actually allow their frontline staff to have, it's a very decentralized model, and allow their staff to have much more say by training them just a little bit more than their original training to administer the right care to people and decide what that care should be with them. And they found that they've actually had a huge amount of success in terms of outcomes for the people that they support and getting better care to them by giving power to frontline staff to make those decisions. And that's part of the design as well in a system or a service, is really thinking about, well, what's the organization structure? What's our operating and power principles at play? It has an impact on the service. And so we need to realize that service design is a team sport. You know, it is a role for people. I guess used to probably class myself as a service designer. I'm sort of a business owner now. But, you know, I would have a role and responsibility to be really good at understanding what that full stack was and helping facilitate people to make decisions around it. But really, service designing is a collective action. It's a team sport. And we need to consider that user-centered organizations are like what we call a weak link sport. And I took this from Malcolm Gladwell, which is thinking about weak link and strong link sports. So a strong link sport might be like having Michael Jordan on your basketball team. You only need Michael because like one guy is good enough to go from one end of the court to the other. I'm sure the others are great. But in football, if you have a weak player on the team, it doesn't matter if you've got the best strikers in the world. If your defenders and midfielders can't take the ball up the field, you're not going to get it to them. So in an organization, you have to find where your weak links are and make sure that everybody has, you know, a similar kind of design literacy and fluency. And I think a lot of that is where my work actually sits, is building a basic design literacy across systems and organizations to be cognizant and conscious that they're actually making design decisions and to understand what good decision making looks like in order to get good outcomes for users. I often think about fluency as well in terms of training and upskilling people as we go through a lot of the projects we do at Snook, which is building fluency and then being able to kind of repeat good practice as well. And this doesn't negate the need for masters. I think skilled and experienced designers and the discipline is absolutely a thing. I never ignore that. But we can't have masterful designers without having everybody having a basic literacy in design. So I think that's really important sense. So I guess that's the first chapter to my talk, really, in terms of thinking about the elements and components and materials that you need to design with in order to make sure that everyone is making smart decisions across a stack, which you can take from a service or a system context. So I'm going to tell you about two case studies today. So the first one I'm going to start with is with an organization, a charity that was formerly called AdAction. I sit now as a trustee, but we did work with them as Snook as well, and talk a bit about how they've been stewarding, you know, the service stack that they have and their organization through a testing and learn process. So AdAction, as they were formerly called, and I'll reveal their new name in a moment, they've been in business for about 50 years. They were established by a woman called Molly Craven, who wrote into a national newspaper in the 1960s, looking for anybody out there who had support for her son who was addicted to drugs. And lo and behold, lots and lots of people got in touch and found that actually drug addiction in the 60s was a huge thing. And people needed support from one another. And our organisation has grown from the 60s in supporting over 130,000 people a year, and having mental health services all across the UK in physical outposts and online. And when I came to work with AdAction at the time, I worked with them through Snook, and we were looking at this project around IAPT, which stands for Increasing Access to Psychological Therapies. And that's an NHS, a National Health Service, mandate to start making sure that we can have talking therapies in place for the mental health crisis that exists in the UK. So AdAction runs quite a few of those services in the southeast of England, and they were losing a lot of clients between first referral, so either self-referral or through a doctor, and the assessment, and getting them kind of through the process. And it's really important from a business perspective because their model indicates that they need to get paid by commissioners for people completing the service, but also we want to make sure that we support people with their mental health. So we did everything you would do in a normal kind of service design project. We undertook user research. We spent time on site when we were allowed to. We listened to the calls across the process. We attended some of the therapy sessions, which when we were allowed to attend group sessions were great. And we actually just built them a kind of end-to-end map of what their service actually looks like, highlighting where, there was challenges within that and where there were different user needs. And that was just really important, getting an end-to-end view of what the actual service looks like. We found things like this, like as a client, I need confirmation that my registration has been completed so that I can feel confident and assured. Some people didn't even know when they had an appointment that they had one. So some really basic kind of things, all the way up to other things like reducing anxiety, just clarifying waiting times for people, and trying to encourage people to, get online for bookings, because we were even having people going to answer phone and having 600 answer phone messages and nobody getting back to them because we literally could not cope with the flux of people trying to contact us. So in order to change the service, we looked at that kind of the whole end-to-end process and just created lots of different prototypes to try and improve it, from thinking about the content design at different points of how we confirm appointments, how we help people reduce anxiety, implementing a new booking system, and doing lots of different kind of little prototypes in order to try and improve incrementally the outcomes of that service as it is now, and focusing on the now, what could we pragmatically do now, rather than a kind of future vision that would be probably quite difficult to realize in the current current arena. And we were really successful. We managed to get about 800 people more into treatment, a 30% increase in appointment booking, and decreasing people who are discharged and never book an appointment, which is just a phenomenal outcome after a couple of months from a very short 3-week or less than 3 weeks project. But the real success, I think, actually for me, apart from the outcomes for users, was the impact that it had on Hannah that we got to work with, who's just now head of service and fantastic individual at the organisation, who wrote this blog post about how we're using design to help improve talking therapies. And she took it upon herself to work across the other services, try and create similar patterns and changing the design. It's been fantastic. And I think this was one of the first really visible, I'd say, design-led projects in the organisation, where we were testing and learning a new approach. And we weren't really trying to talk about design too much, but more testing something and learning from it and implementing it and trying to improve what we do. And it's a really exciting time at the charity. We have an ambition to help 10 times more people. It's really ambitious, I think, and it's going to require deep shifts in our organisation, how we think about what we do. So what we've been doing is embedding a test and learn approach inside the organisation to develop, our strategy. And when I say I'm talking at this point in time as a trustee, so I want to give credit to all of the organisation who's actually leading this hard work. But they've been doing lots of fantastic things, trying to just change the contents on our website to make it easier for people to understand what it is we do and how we work. They've been making sure that they get naloxone out to people who have drug addictions, particularly opioid addictions. Naloxone is something that essentially can be administered really quickly and help bring you back to life when you're overdosing. And it's immensely important that people have that. And what the team did was look at the process of getting that out to people. It used to take, I think it was 25 minutes, I can't remember, to go through the instructions, and that people don't have time to do that, and they redesigned that process to get it down to a few minutes and just get naloxone into the hands of people. And we actually found that more people we're accepting it through our redesign process, which is just fantastic, and ultimately saving lives, which is amazing. But going back more into our full stack, we've really been asking the question of, well, if we're going to design new services that help 10 times more people and refine what we do, what does it actually mean to get better? And that is a fundamental question you need to ask yourself when you're working with your own services, your own organization. But we are part of a system of drug and alcohol support, which is filling in a lot of the gaps that we don't have in clinical or government provision. So we're actually trying to ask this really, I guess, as a whole sector. What does it mean to get better? And we have outcomes set for us by Public Health England, which are called the National Drug Treatment and Monitoring System. But it can be quite difficult sometimes to have these national outcomes because they can really define how your service should be set up, so that when you measure people, you're showing to be successful. But sometimes in cases like helping people come off of drugs and alcohol, when they leave your service, they're going to feel worse. So how you're measured is really, really important, because what is right for the users might not be right for the way that the government measures you at a national level. So these things have to be either A, challenged, or B, worked with and around. They've been doing lots of stuff looking just at actually becoming data led, and we had lots of really amazing data scientists come in and do a hack with us to try and understand all the data that we had on how people were completing services or not, and what that meant. We've also been trying to help staff spend more time at the front line and looking at that part of the stack, and that's by providing better tools, better guidance, and better training for them to be able to think about administering the service in the best way that they can. We've been doing projects around starting recovery as well, and trying to actually break down now what our different services are and what the different kind of stages of the journey are, that even though we have quite a hyper and localized offer, hyper-local offer across the UK, that there are similar delivery modules and content in what it is that we do. So undertaking kind of user research projects like this to start framing what our new offer can look like. I think one of the really big things, so that's like a kind of whole set of work that we've been doing, really working through that full stack all at the same time, which is quite complicated. But one of the really big things I think that came around through this, I've been super impressed to watch this organization do it, is to work through rebranding themselves as they're thinking about the service and the system that they operate within. So they had a lot of stuff around the word addiction and sounding like addiction, and people, service users thinking that it sounded really negative, that they were being labeled. And it was actually not allowing people to come forward that maybe had maybe like an alcohol problem, but they weren't injecting heroin, and them seeing themselves being stigmatized to be, a certain type of drug taker, and it's kind of a whole confusing stigmatization, societal stigmatization of what it means to actually get support for your mental health. And service users said that really our staff counteract that, that they're always treated with compassion and respect. And overall, service users used the words like warm, non-judgmental, motivating, supportive, and fed back to us that other places that they've been to had made them feel like a number, but here it was about them. So we know that the team that deliver our services formerly at Action are phenomenal and great, but our brand wasn't really representing that, and it was definitely not feeling open for people to come who didn't align themselves with someone who had a quite acute drug addiction. And if we want to help 10 times more people, we obviously need to open up. So we worked with a brand agency and the internal communications team at With You, and worked across the country really with different users and staff to actually co-design and test the brand as we went through it, looking at the right wording, color palettes, what we were saying as well, what kind of services we were presenting. And then we became We Are With You, which is hopefully you agree, a much better name, I think, much more fitting and just a bit more brighter and vibrant. And really fantastic, because the words that people came back and said that made them feel was reassuring, approachable, human, and that they were 3 times more likely to feel comfortable getting support from We Are With You. And in a kind of language sense, it works a lot better. Are you worried about your drinking? We are with you. Do you want to cut back on drugs? We are with you. Are you just overwhelmed at work? We are with you. Need to talk? We are with you. And it kind of works really well on a load of different levels. So the feedback was absolutely fantastic of people saying, they'd actually come to this, is just asking you to talk. But it allowed us and paved the way quite quickly for us to rethink about what is our front-facing touch points. So really redesigning our website had to go hand in hand with the brand. But what it really allowed us to do was to start developing new types of content where people can almost self-serve in a sense before having to come into a centre or work with us online. We managed to change the way that you can find services as well, but really importantly also launch launched more formally a web chat service where people can talk to us online, and we've been inundated, particularly during the pandemic, of people using that option who maybe can't come into one of our centres for health reasons, but in the future may not want to as well, which has been great. So it's really helped us to start redefining our offer in a bit of a different way. And it's been fantastic having all the staff get involved and really get behind it. And I think this year they've been absolutely incredible during the pandemic and rallied together to deliver services in pretty tough times. But I think what's the most interesting thing about this is that just a rebrand has thrust us from being a commissioner-based model where we get, paid locally by results or contracts, to being much more of a kind of blended, essentially business to customer model, where someone could come and web chat from anywhere across the world actually and use our service. And we've got to kind of think about what that means. And what that means that we're trying to do at the moment is actually test our way through lots of these strategic questions, really thinking like at the moment, what are our services, beyond what I've shown you today? How do we make money from that? Because we have to make money to be sustainable. How do we reach our users? Who actually are our users? What does good look like? What is our service model? And we're running a complicated business with people who have complicated and complex needs, people who are in real need of support with a pandemic, whilst trying to design and figure out all these questions at the same time. And this is a really kind of, I think, quite a sort of like strategic way of working using design. But I'm going to sort of like build on that now, because I've talked a lot about this from a service context, but you'll see I've kind of interchangeably used the word service and system, because services don't exist in a vacuum. They're often part of a system. In the case of With You, we're part of the system of drug and alcohol support and government. So I want to talk a little bit more about the sort of holistic approaches that we need to take on systemic challenges now as designers and take it up one more level. I really love this quote by Dan Hill. He wrote a fantastic book called Dark Matter and Trojan Horses. And he said this, that a systems-orientated view of problems challenged the idea that healthcare is the responsibility of a Department of Health. Health is directly affected by urban planning, transportation, other infrastructure, patterns of employment, food, education, industrial policy, retail policy, and so on and so forth, most of which will sit outside the boundaries of a neatly defined department. And I always hold on to this quote by Dan Hill, because when you're designing, you have to take a systems perspective in everything that you're doing. And I'm going to build on a little bit of work. I'm going to tell you a bit about a program called Systems Changers, and a bit of work that Jenny McShannon did for that, who's a phenomenal systems thinker, and present some of her work to you today when she talks about a kind of system of elements that, she describes a system as a set of elements that are interconnected or organized in a way that achieves something often called its function or purpose. They're made up of elements, interconnections, goal, functions or purpose, feedback loops, values, beliefs, and mindsets. So systems thinking is a way of understanding and working with complexity. And this complexity can be characterized by ambiguity, so uncertainty about what is occurring and what others require, rapid change in information and events and context, unpredictability that is inherent in the situation, strong links to other problem areas because systems are often incredibly complex, and also a sense of being overloaded and not in control. So when the problem is difficult, you can take apart all the bits and see where the problem is. If you have a car and an engine, you can be quite we call this reductionist thinking or mechanistic thinking. And we can break apart systems like that. But we kind of can't really. So when a system is very contained and well defined, it's much easier to be reductionist about it. But often systems look much more like this. They're part of a tangled mess, and they call for lots of different approaches when it comes to challenging and changing systems, because the problem actually lies in how all the parts work together and the interconnectedness between these parts. A problem like this can be beautiful, but layers of systems and subsystems are all reflecting the overall complex structure. And so using systems mapping as a tool has been quite a kind of critical way of people trying to think about this complexity. It's a format for really developing multiple vantage points that pave the way for a plurality of solutions. This is a pretty famous map, actually, from Foresight's Tackling Obesity's Future Choices report, which is now about 10 years old, by Susan Jebb. And their purpose really was to help develop a framework for action which could be robust in the face of changes in external circumstances and really take on the challenge of obesity in our population. There was lots of different improvements made that have been made, actually, I think, in the last sort of 20 20 years, and particularly 10 years since this was published. But the prevalence of obesity in 2030, as a projection stand, are almost 10 percentage points lower than feared. And Susan, kind of reflecting on this map 10 years later, said, it'd be foolish to claim that these modest improvements were down to the report, but she did say that it certainly heralded a more considered approach to tackling obesity in the UK. After the launch, it was quickly followed by lots of different strategies, around healthy weight, healthy lives in England, and a successor called Healthy People, Healthy Lives. And these spurred different government-led social marketing campaigns, Change for Life, which run for nearly a decade now, new government standards for the procurement of food in the public sector and food provision in schools, modest restrictions on the marketing of food to children on TV, investment in cycling infrastructure, so on and so forth, because you cannot solve something like obesity, a system-wide challenge, which is down to individuals and environment, by having one silver bullet. So these are fantastic ways of starting to think about that. And there's a couple of different ways of really thinking about, tackling these kinds of problems. As I said, you can be much more reductionist about it, or much more kind of holistic and take an approach of holism about it. And you can see this in ways in the past in which people like Nixon have, taken on the war on drugs, as it was called in 1971, and actually these being criticized as not being that effective because they've taken a difficult problem as a war on drugs approach, trying to agree what the problem is, recognize an agreed solution, and boundaried time in terms of how you actually approach in solving that, which is to essentially like lock people up, which has created and inferred lots more problems actually at a societal level in the United States. But actually, a messy problem way of solving that is taking a systems response, from looking at education to decriminalization and destigmatizing drug use. And so that kind of approach is about having no agreement on the fact that there is one problem to solve, and that the time, resources, people involved to solve that is unbounded. And you often see government kind of taking, I guess, the more difficult problem, very reductionist approach to the ways in which things can be done. Not across all of the world, but certainly I've seen that in the UK a lot. And so you can think about it in this way, as I said, strategies for tackling different problems often come down to reductionism, which is like taking apart the car engine and breaking it down into little small parts and trying to solve it. But I much prefer to play in the kind of like sticky, messy space of kind of holism. It also does simplify problems, but by discarding a sort of level of detail and kind of coming up the way to think about the connections between those problems and ways in which we might start to plurally solve them in an unbounded way. And we do a lot of this work at Snook. This is a piece of work from one of my team called Ness, who's amazing. And in 2018, she looked at food systems in Dundee in Scotland. And instead of just working in, I guess, a kind of design way to try and help get more stuff growing there, actually tried to look at the different challenges that exist from a systems perspective. And what Ness talks a lot about, and what I talk a lot about in systems thinking and change, is looking for your levers. Like, what levers can you actually pull and change to make things, affect them at a systems level? And I really like this sort of table she put together in terms of things that can have high impact but are hard to shift versus low impact and easier to shift. So, high impact and hard to shift are things like mindset and beliefs are very ingrained, there's a lot of different reasons for why you can have an ingrained mindset and beliefs, down to just the kind of independent elements of a system that you might be able to change, like how a meeting is run to decide on an outcome, or the criteria we use to evaluate somebody, or actually just making a website more easier to use. So there's lots of ways in which you can look at a system and sort of score the levers that you might pull. And I think what's really interesting for me is I always talk about the fact that big challenges need a plurality of small solutions. One of my favorite small solutions, which I think had a massive impact on a system, was by a fantastic lady called Michelle Miller-Fisher, who in 2019 is really frustrated with an inequality in the museum sector and arts, created an open Google spreadsheet for staff in the sector to openly share their salaries. And despite the fear, people actually committed to it. And it was really a massive political act that nobody had ever shared this stuff before, but led to a lot of conversations and starting to think about how do we have a sector in arts and culture in the museum space that is more about equity and is more equal in how we pay people and reward them, which is fantastic. It's a very small solution that has started to have quite a massive change. So these small levers can be pulled. The same is for an amazing doctor called Dr. Gutman, who fled, forced to flee as World War II erupted, and found himself by the British government being asked to found the National Spinal Injury Centre at the Stoke Mandeville Hospital. And Gutmer was a huge believer in the power of sport to change lives. So in July 29th, 1948, he organised a sports competition for British World War II veteran patients with spinal cord injuries. And these were known as the Stoke Mandeville Games. But I want you to fast forward to 2012 and the Olympic Games in London, where over 2.6 million tickets were sold, with over 4,000 athletes from 164 countries for the Paralympic Games. And his movement, the Paralympic movement, which is a phenomenal movement, was born from a very small event, but he persisted and kept going on it. So these levers, these events, these small things can have a massive shift in challenging society and shifting, particularly around disability in the Paralympic Games, around the mindset, the cultural perspective on disabilities. So these small things can have a massive difference. So I always think about where can we identify smart leverage points where we can make a difference in society, even if you have to be patient about the change it might bring. And how can we convene people around a challenge and working in collaboration with that? Because we have to bring, as we solve the full stack stuff, everybody around that. So I'm going to talk really briefly about a project called Systems Change, Systems Changers from the front line. And we worked with the Point people, who are fantastic London, I think, well, not all London now, but based organisation, and Kelly Chase, who are a foundation that support people who face severe and multiple disadvantage, and the organisations that are helping them. And they asked us to look at building this program called Systems Changers, and we joined the Point people to help kind of develop it and run it. And they asked this question of can and how can the insights of frontline workers influence systems change? So the program is sort of made up of three, I guess, interrelated elements: teaching them about systems thinking, teaching them about change making, and teaching them about design thinking. And we brought together, we've run like a few cohorts now, and we brought together about 12 to 13, 14 people each time. There's a couple of the lovely cohorts that we have had, and all working in, I guess, frontline roles, which can be an ambiguous term, but mostly working directly with clients of theirs in different things like domestic violence support services, helping people move from prison back into their communities, helping people who have drug and alcohol challenges, and working across lots of different types of parts of the system. But we took them from one geographic area so we could try and create some kind of boundary around the system they're working in. So we worked with them over about 6 months, doing lots of different sessions and training some of the elements I showed you about, and getting them to reflect on sort of three sort of lenses to think about what they see in the system in front of them. So what does this mean to you as an individual? How do you respond to that? What does this mean for your organization? But what does this also mean for the wider system? And we encouraged them to kind of do two things through how our program was designed, which was to explore the system they're in, just unpack it, understand it, look at different vantage points around it and find the flex in it where they can make changes. And then actually for the second half, create either, lots of kind of plural projects where they could take the change they wanted to see by testing different ways of changing that in a system. But this program is also really about insights, which is making sure that we focus on how we help people hold the space for insights to surface. So it wasn't supposed to be a personal development program. It wasn't about solutionism, trying to solve the system or service. It was about really finding insights in where the system could be changed or challenged. And because you had Kelly Chase funding it to work at a systems level across supporting people who face severe multiple disadvantage, that was quite useful for them to see. So the sessions look like this. They actually hopefully look quite fun. This is lots of pictures from our outside session when it was lovely and sunny and we could all hang out together. We worked through lots of different tools to help each individual think about that individual organisation and systems level they were working at. And we did a lot of different forms of systems mapping, cause and effect mapping, looking at holism approaches, and really helping people to start to actually try and see things in new ways. And I think what's really interesting is when they were able to translate the shift in perspective into new ideas and then translate these new ideas into new ways of being and new ways of doing, it was a really fantastic moment. But it took quite a long time to get the frontline teams to even just step away from being immediately concerned about just their client and seeing things from a much wider systems perspective. So we kind of saw like two, I guess, massive shifts through all the training that we did on the program, the projects they did. So one was that participants saw the systems they work in differently. That they weren't just kind of just thinking about the client, they were thinking much more widely than that and bringing their head up from being in that sort of sandpit, I guess, in a good way. But participants also saw their power within the systems they work in a lot differently. Lots of people we found felt that they had a place in a ladder, in a hierarchy, and that they maybe didn't have the confidence or the right to challenge the system. So with all that kind of training and new ways of thinking, what we asked people to do was to take research that they'd done and insights that they created and barriers that they'd found to develop multiple projects, lots of levers that they could pull in the system that they were capable of delivering to. And I've way too many projects I could share with you, but I'm only going to share 2 today from that. But some of them were quite simple and some of them were much more theoretical. This was from John, who actually looked at the ESA benefit system, which you saw in the video at the start, and actually created a pack and tool to help people actually navigate that system. He found things, quite simple stuff like knowing how long the KPIs is, the key performance indicators for someone on the call, is maximum a 28-minute call. So knowing what you have to get through before you kind of get hung up on and told to go away. And creating sort of leaflets for it as well to help anyone who's supporting anyone at the front line to navigate that system. And that required John to go quite up the chain and look left and right and up and down to understand actually what was involved in the system and why his clients were facing, like you saw in the clip, such a hard time in trying to claim their benefits. And CAF did an amazing project with an organisation called York Road, but they looked at this kind of whole approach called humanising language and actually changing all of their approach as an organisation and other partners in their system to be positive in language. And that might sound a little woolly and not a real design, but it had a massive impact on people who, I guess, are treated often not very well and not with a lot of respect, to actually just say things like, please, can you do things, and thank you, and seeing that that could actually change how they performed in the system. We also managed to get some of the system changes anonymously to share their stories at a national press level, which was another lever some of them wanted to pull, to make sure that people could take note actually of what the system looks like. So we had people looking at some very small, quite service-located projects. We had people looking at a kind of media change campaign lens. We had people looking at behavioural change in the system. So lots of different levers that they could pull. And we saw people kind of, I guess, taking on lots of different roles and styles. We had roles that looked at kind of more revealing, I guess, the system. And then roles that looked much more around people who ended up driving that change as well. And I think that was a really important sort of distinction in different roles people played. No one who's a system changer can do all of this and can manage to change everything all at the same time. So we saw kind of people assume different types of roles, from revealing to generating ideas to sustaining them and supporting them. And most participants tried several of these approaches, and these changes in behaviour we found to make up huge differences to the public sector systems that they work within. I think the programme demonstrated how all these roles and processes are important, and that one is not more powerful than the other. So we have to play a plurality of roles when we're changing systems, whether we're doing it with lots of other people or doing it ourselves. And we kind of found, I guess, different ways in which the insights of the front line and their contribution to change can be unlocked. And it was these 5 things, which is we need to actually just create the time and space to do this thinking. One of the most powerful things actually about the programme was giving frontline teams just the ability to think. We need to think about how we disperse power, so giving explicit permission to staff to question how a system is working. Don't assume that people will speak up if things aren't functioning well, but we've got ours to speak up. Take down language and evidence barriers, so breaking down official language and jargon and accept new forms of evidence. And that levels the playing field for those who want to create change and doesn't lock them out. The 4th condition really was nurturing community. So it can be very hard to make change happen. So helping staff form peer relationships to support each other was really important in this. And I think the programme showed and demonstrated and tested a way of that. And in model system change behaviour. So wherever you sit in an organisation, take some of the ways of being and doing we've just described as a leader and do that. So the programme found that frontline workers have a unique vantage point in the systems around complex disadvantage. And I think systems change can often be thought about from that very big map perspective, and we need to do that. But actually, a lot of frontline staff can understand the cracks and the challenges and how the system is completely underperforming, which is often missed in reporting or documentation or things like that. So just really briefly, these are some of the feedback that we got from the programme from different individuals who've been through it. You know, people saying small change can make big differences, which I've talked about today. that there's no one person to blame. You know, someone was always holding a bad guy at the top as the problem, but actually the system was made up of lots of different unconscious design decisions. Seeing other people's perspective in the system was really important. People realized that, you know, they were just defending the client and blaming the service, and actually trying to step back was super important. Lack of immediate access or power blocking happened a lot. So when people were doing their mapping, they could find kind of big circles where they couldn't even get into. You know, people go into different service loops or different structures and disappear from view, like going to prison or using mental health services. So people find that kind of quite alarming, that the system isn't visible to everyone. So that's why we need this kind of connected upness to share it. People had new confidence in techniques to present evidence, and we found so many of our system changers kind of, a lot of them got promoted actually, which was really not the point, but was really cool in terms of being able to actually go and present new ways of seeing the challenges in the system using mapping and different forms of visualization, which they'd never really used before. We found direct power challenges happen, and actually one of my favorite outcomes was by one of the system changers in Manchester, who actually teamed up with a lot of the other system changers in Manchester in the UK. And they were able to meet with Sir Richard Lees, who's the leader of the council. And they actually developed this program called the Elephant Room, which brought together people who have complex needs, the 15 most powerful people from the council, and 15 kind of service owners and organisations to just talk about what the challenges were in that, and in the systems around Manchester for people with complex needs. And that might seem like it's not a very sexy solution. It's not something I can put in the Fast Company website, you know, or on a tech magazine. But just having that conversation is a direct power challenge to the system that exists. And what some people realize is that people like just, you know, going to meet people like Richard Lees humanized the system for them. So I thought that was for me, it was one of the most powerful, I guess, insights from the program. So I'm just going to talk now a little bit about strategic imagination for emergent systems, and move a bit more into, if we come back to kind of the masterful designers, or what you're doing when you're called a designer, how we might be operating in this space. So I really love this sentiment from Rival, strategic consultancy in London, when my friends Ben and Marta talk about the fact that strategy is sort of this broad concept that's often unrecognized but shared by large numbers of people. And I really think about some of our role as designers is in building that strategic imagination really consciously across people, but within the context of thinking at a systems level now as well. And Umar Haque talks about, you know, the kind of surest, most lethal killer of strategic imagination is being reined in by orthodoxy, that thinking that tomorrow must be like yesterday. But we know now that every organization must be prepared to abandon everything it does to survive the future. And the survival in the future is, you know, at peril at the moment, given things around climate change. And we cannot, you know, as individuals or even small groups, design a whole system and implement it, but we can collectively help people dream what a different tomorrow might look like. And I love this work by Cassie Robinson, who's one of the founders of the Point People and a fantastic writer and thinker all around, about this model from the Berkana Institute around looking at the different roles we might play in stewarding people through different forms of systems visions. And some of us, it's okay to be just in the dominant system and trying to improve what that might look and feel like, just redesigning services, making the system slightly better. But others trying to move much more into kind of imaginative space, stewarding us into the emergent system. And those things will happen in parallel together. But what is difficult for a lot of people is that the imagination gap is really, I think, the biggest challenge to having a aligned strategic vision. And I think it's our role in helping people make their way through that. You know, as designers, we're people who make. I love this quote from Mike Bracken, who was the gaffer of Government Digital Service for a while, an early meme that came out that said, "The strategy is delivery." And he went around and asked lots of CEOs, you know, why did you not deliver things? And they said, well, we spent too long making strategies and not enough making. And so his big mission was to make stuff in order to deliver the strategy. And I think that's where, as designers, we need to think, well, if our strategy starts before design but continues, you know, with designing, we've actually got a strategic role to play in making that strategy, you know, a reality. So we need to take the strategic role of what we're actually making and prototyping and being informed to seriously. And recognize that 10% of our work is ideas, and 90% of the design is bringing people on the journey to agree with you, really, and bringing form and shape and narrative to that. one of my really kind of small examples from Snook is working for many years on this concept, being pioneered really by Anne Deere, who's our director of missions, around Government Zero, which is essentially making the internet the fourth utility, because a lot of people can't access it for different reasons, from skills to financial reasons or access to a good enough device. And during the pandemic, we managed to get lots of all of the British telcos to agree to give NHS and government data access to those websites for free to anybody, meaning that we sort of achieved, in a sense, a little bit of Government Zero, but by pulling a few levers. And really, for me, this is a way of making the strategy a reality. This is not going to last forever. It was a kind of pandemic-based intervention, but it shows you what is possible. And I think when you are a designer and you're helping develop a strategy, you've got that role in both helping people see that strategy and understand it, but also making it a reality. And this is a kind of small example of where we've done that before. So let's just come back to you as an individual now. We're always going to be designing in tension. The world is full of different tensions. You know, if you're involved in designing technology, it can be used for good and bad, often within even the same organization. I hate to be stereotypical, but, you know, Facebook helps people find organ donors, you know, for specific blood types. It also helps swing elections. So we have technology for good and bad. We have people that say, I don't want to work for really big corporates, versus, you know, I want to find an organization where I can really affect change. Well, I'm not going to comment on Tesco here. I'm just using them as an example, but, you know, they've been branded as unfair and unethical and taking over small towns and removing all of the kind of like local industry. At the same time, you know, they're doing things like being really committed to driving down food waste, and actually being the first major supermarket brand in the UK to sign up to this Sherio app called Olio, which is a drive to kind of stop edible surplus food going to waste in the UK and help feed more people in crisis. So they could be considered bad and good. But we have to even recognize that even when we work communally with people, and because we have to do that when we work across systems, that we all have very different views on what is right and what's wrong. Take, for example, the new conundrum of the emergence of automated cars. When a driver slams on the brakes to avoid hitting a pedestrian crossing the road illegally, they have to make a moral decision that shifts risks from the pedestrian to the people in the car. But self-driving cars might soon have to make these ethical judgments. I think this is a massive moral code, a universal moral code that's trying to be made into these technologies that will be used across the globe. So curious to see if the prospect of self-driving cars might raise other ethical conundrums. A really fantastic scientist called Rawan gathered an international team of psychologists and anthropologists and economists to create what they call the Moral Machine Quiz. Within 18 months, the online quiz had recorded over 40 million decisions made by people from 233 countries and territories. Basically, it laid out these different scenarios where people could choose different variables of who they choose to save versus die, involving different variables like young or old, rich or poor, more people or fewer. And it's difficult because people really encounter, you know, really rarely encounter such stark moral dilemmas, but it was still an interesting quiz nonetheless. And what they found actually is that there is no such thing as a universal moral compass. In fact, the ways in which our governments govern us, the ways in which we have access to, you know, religion and our religious beliefs, the way that we're brought up, the media that we consume, all have an impact actually on how we think about the world around us. And so it's very difficult. There's always going to be a tension because our morality is not the same as each other. Sometimes we find it, as this shows, at societal level, we can have similar guiding principles, but there's never really going to be a universal moral code. So designing intention in a complex world is super uncomfortable, and I want to leave this here with you. As I've been saying this whole way through, from services at full stack level, to systems, to vantage points, to our roles, we've all got a role in consciously designing the systems of the future. But more designers, much more design, is not going to equal better systems or outcomes. It's going to require a shift in our practice, moving from individualistic designing to much more forms of systems designing, you know, not delivering a solution, holding plurality, not just delivering a vision, stewarding strategic imagination of many people, not having ownership of a problem, forming a stewardship of problems, not just building prototypes, testing levers. There's lots of ways in which we need to move into much more systemic ways of designing in our own practice and our own self. And, you know, it feels really uncomfortable right now because we're facing absolutely existential threats to our own society and to human beings. And I think the climate emergency is the biggest, tension that we're designing in. This uncertainty is causing climate anxiety. It's actually been coined by a psychotherapist and author, Linda Buzzell, and psychology professor Craig Chalquist. Put this kind of glossary of sorts together on eco-anxiety, and it's giving us an inability and uncomfortability to make decisions. And that's really hard because as designers, our sole job is to set intention, is to take, intention and design with it. And sometimes to set intention and design with it. But if we are feeling completely uncomfortable to even move, that creates a really difficult challenge for us on an individual and group level. And the only way I can really leave with that, because there's no easy answer, we're just going to feel uncomfortable. The secret to living with uncertainty is to learn to sit with the discomfort of uncertainty and just get used to feeling uncomfortable. I coach a lot of quite younger designers. I help grow my own team. We've got a team of about 80 people now. And I find people saying design is really hard. Well, it is hard and it is uncomfortable. But I really love this kind of idea from Tamar Chansky that, the idea of a swimming pool is like, you kind of just need to get in it. You're going to be getting told to get out, it's too cold, it's too cold. And we kind of think if we stay in the pool, the water is going to warm up, but it's not really going to get any warmer, but we just habituate ourselves to the discomfort of the coldness. And I kind of want you to hold on to that because, as whether you call yourself a designer and you're watching this, whether you are involved in making conscious design decisions, maybe you're not involved, but you're now thinking I should. We're all going to be uncomfortable. We're all going to have to make tough choices, but we're going to have to try and make what we think are the right choices. But as long as those choices are made both for the needs of people and the needs of the planet at the same time, I'm happy for you to be uncomfortable within that. So thank you for listening. I'm hoping to be there with you very shortly.